The following presentation outlines a study conducted at Wayne State University Eugene Applebaum College of Pharmacy and Health Sciences called Step Test Evaluation of Performance on Stairs, Adaptations, Reliability, and Ease of Use for the Chronic Stroke Population. After a stroke, individuals experience difficulties with postural alignment and functional tasks as a result of instability due to poor postural control, decreased balance, and reduced motor functions. As a result, post-stroke individuals are at a higher risk for falls. There are many established outcome measures that evaluate gait and balance over level ground, but none that assess stair navigation. Recently, the STEPS test evaluation of performance on stairs, the STEPS tool, was created by physical therapists as an evaluation tool to be completed during stair climbing. However, the STEPS tool was validated in the Huntington's population, but has not been validated for persons post-stroke. Establishment of a reliable stair assessment that is related to functional performance and fall risk is critically needed for the stroke population. The purpose of the study was to adapt the STEPS tool to be more specific to the chronic stroke population, determine the ease of use among clinicians, and begin to assess the inter-rater reliability. Based on the purpose, we hypothesized that modifications to the current STEPS tool would be needed to make it more specific to the chronic stroke population and increase ease of use among clinicians. In addition, we hypothesized that the STEPS tool would be trending towards significant and inter-rater reliability. The research design was descriptive in nature and conducted via Zoom. Participants had to be licensed physical therapists or physical therapy students to be included in the research study, and the breakdown of participants is listed on the slide. Outlined on the slide is the timeline followed to get to the final adaptations. 2 separate sessions were conducted, and the participants were separated as to only attend one session. Each session entailed rating 5 videos using the STEPS tool. The first 2 videos were watched for training on the tool, and 1 video was watched twice. Following training, 3 videos of patients with chronic stroke were watched and graded. Discussions were conducted during the training videos, and a focus group was held after the final grading had been completed. Finally, adaptations were made to the STEPS tool after each session based upon feedback. As there were COVID-19 modifications made to the research method and design, all data was analyzed using descriptive statistics due to a small sample size.
On the left is the original STEPS tool. On the right is the modified STEPS tool that was developed over the course of the study. Adaptations are made to the formatting of the tool, including adding space for recording demographic data and time of ascent and descent. The changes allow the tool to be replicated at a later date. Changes were also made to certain items that commonly cause confusion. These modifications make the STEPS tool more specific to the chronic stroke population and increase ease of use among clinicians. The variability in rater scores prior to and after watching the STEPS tool training video is shown in the figure on the left. The variability between rater scores decreased in both sessions 1 and 2, showing the effectiveness of the training video. The average scores of the PTs, PY3s, and PY2s for the 3 practice videos and 3 patient videos is shown in the figure on the right. The range of average scores of the PTs, PY3s, and PY2s decreased from 2 for the 3 practice videos to 0.2 for the 3 patient videos. This demonstrates the effectiveness of training prior to using the STEPS tool on patients. The main purpose of this study was to modify the STEPS tool to be more applicable to the chronic stroke population and increase ease of use among clinicians. Changes to the STEPS tool were based on which movement patterns are commonly seen in the chronic stroke population and which patterns would impact the patient's safety during stair navigation. Formatting changes improved the tool's usability and now allow the tool to be replicated at a later date. The variability among scores decreased after the participants received training on the STEPS tool, which demonstrates the importance of the training and becoming familiar with the tool before using it on patients. The study showed that the STEPS tool has the potential to be a reliable outcome measure to assess stair navigation in the chronic stroke population. However, additional research will need to be conducted once in-person data collection is feasible. Future research should determine the validity and reliability of the tool and its ability to be used in a clinical setting. Future studies should also establish a relationship between a score on the STEPS tool and fall risk. Limitations of this study include limited video footage and a small sample size of participants. Due to COVID-19 restrictions, all data collection was performed through online videos, which may not translate to in-person clinical use of the tool.